Now, the head of mental health unit at the Techiman Zuno Hospital, Twang Gilbert, has expressed concerns over the lack of mental health facilities in the area. He said the number of mental health illnesses recorded in farming communities is on the rise, as most farmers are into the abuse of hard drugs to aid their work, and steps need to be taken to incorporate mental health services into the National Health Insurance Scheme. And Asabet has more in this report.
Substance use and misuse can affect every aspect of a person's life, and health experts say substance abuse is contributing to the increase in mental health cases, particularly amongst rural folks where access to treatment centers are limited. Head of Mental Health Unit at Zunio Hospital, Twang Gilbert, says most farmers are into hard drug abuse due to its ability to aid their work whilst on the field.
In my area of practice as a mental health officer, I've come across so many conditions of mental health concern. In our jurisdiction, commonly we come across the tramadol and then the weed or marijuana abuse, which is leading to addiction. So we have realized that in this our area or this jurisdiction, the mental health cases arising are commonly from the substances. And we know we are surrounded by a lot of farming communities, which commonly they abuse some of these hard drugs just to be able to work or to stay on their feet and work. And then the cases we have recorded so far accounting to mental health conditions are coming from the hard drugs.
The mental health expert expresses worry at the unavailability of rehabilitation centers throughout the Middle Belt and asks that Zunio Hospital is working towards establishing the first rehabilitation center in the region.
If you look at the area from the Middle Belt coming to the Northern Belt, we can only count one, which I know is in Kumasi Rehabilitation Center. The rest, we have to transport patients from Techiman and then from the north to Accra or Cape Coast, who have the major rehabilitation centers. Apart from that, we cannot boast of any rehabilitation center in our Northern Belt, even in Bono East or Bono region. So we have taken this initiative. We want to be the first facility to set up this facility to take care of the needs of people suffering from addiction and their mental health problems.
He wants the National Health Insurance Authority to incorporate mental health into its care. He also wants government to subsidize the treatment cost of mental health to help enroll more mental health patients onto the scheme.
To the best of my knowledge, NHI doesn't cover rehabilitation. That is to the best of my knowledge. It is very necessary if NHI or government, Ministry of Health or Ghana Health Service is able to incorporate this into the client care. A lot of people come into this not because of their own will. Some are peer group influence, some are lured into it. So you realize that some people are really willing to get out of it, but the resources to be able to get out of it is what the problem is. So if government is able to subsidize the treatment or management of addiction or the rehabilitation care, a lot of people will be willing to enroll on it.
Reporting for Joy News, Anas Sabit, Techiman.